Many times our clients have the idea that surgical procedures are simple, especially when we say mommy makeover. They assume that these procedures do not have serious risks or possible complications. All over the world, these risks are the same. There is the risk of anesthesia, blood transfusion reaction, of infection, the risk of traumatic damage to internal organs, fat embolism for those that will be grafting fat, and the risk of blood clots. In this video, I'll break down all these risks and complications so that you understand them and you're able to make an informed decision when you are planning to have plastic surgery. First, for liposuction, it is liposuction burns. A burn is an area of skin necrosis. When you hear necrosis, it means that whatever is being talked about has died, turned black like a hot water burn. It didn't survive. Sometimes after tummy talk, if the blood supply to the skin edges is not adequate, that can also happen. It is common when the liposuction procedure is aggressive or a very tight garment was worn after the surgery. Then when the patient has weak skin, for example, the patient is bleaching, so that can predispose to the liposuction burns. It will heal, and for some people, it doesn't even leave a disfiguring scar. It is just like a hot water burn, and the skin will heal again and the melanin covers it. The body will push it out and it will leak, and they'll say, oh, this person's bone was leaking. For the risk of anesthesia, there could be irregular heartbeat, problems with breathing, and sometimes, even though we do not expect that or it doesn't happen, anesthesia problems can even result in death. So for the risk of blood transfusion reaction, we do not even intend to transfuse. If you have watched the process of liposuction, you would see that the provider is holding an instrument that is long with a blunt tip and using it to go back and forth over areas of the body so that the fat lobules will pass through tiny holes in that instrument and be extracted. That process is very energy intense. Some people that work out, that eat heavy carbs diet, with the right amount of carelessness, anybody who is not experienced or skilled can use that blunt tipped instrument to enter an organ space. Again, not even carelessness. In those that are very big or they're taking supplements like collagen a lot, that can also happen. What do we do to avoid this risk? The first thing is that when we need our patients to lose weight, we tell them to lose weight. And those who are very slim and have little or no fat pad in the buttocks, we can use the ultrasound technique to guide. The third way is to decide not to do fat grafting or a BBL, especially when people have had procedures like arm or thigh liposuction. Those areas are notorious for having contour irregularities. If it requires another minor procedure, we will let you know.